1,406 new COVID-19 cases have been recorded in the last reporting cycle. This is the highest number of cases ever recorded in one day since February. This rise reflects a 15.8% increase in positivity rate. The majority are from Gauteng with 2,157 new cases, followed by KwaZulu-Natal's 985 and Western Cape's 681 cases. Meanwhile, the Department of Health has announced 65 fatalities and 5 having occurred in the last 24 to 48 hours. To date, there are 100,276 fatalities recorded since the COVID-19 pandemic began. Now, there are also over 34 million vaccines which have been administered in the country thus far. All right, I'm here to talk to us about the rise in infections and positivity rate. I'm joined by Emeritus Professor of Critical Care at the Wits University, Professor Guy Richards. Prof, good evening, and thank you very much for your time and joining us tonight here on In Focus.
Good evening, and it's a pleasure.
How important is the water waste-based epidemiology in our detection of the COVID-19 prevalence? I tell you why, because, of course, first it was picked up in the water waste, and now it's being confirmed in the positivity rate as well.
Yeah, well, wastewater is often an early indicator that the virus is more prevalent and that more people actually have contracted the virus. It actually occurs before the symptomatic infections are actually noticed and before the percentage increase in the number of positive cases of the tested cases actually starts to increase as well. So it's an early warning sign, and it's an important early warning sign as well.
Yeah, taking that early warning sign and looking now at the positivity rate, very close to 16%, is this reliable data now to tell us of some kind of a resurgence?
Yes, it certainly looks like there is a resurgence. What we have to take note of is that there are two factors that determine the rise in the percentage, and that both is the number of cases, an increase in the number of positive cases, but also that we might not be testing as many people. So if you're only testing a smaller number of people, you are likely to have a higher percentage because those people that are being tested are likely to be the ones that are most positive. So that is another factor that is involved here as well. But nonetheless, it certainly seems to me that there is a likelihood that we are entering another wave at this point. We just have to be a little bit careful again, though. We're looking at the number of cases. And what we're really concerned about is the number of severe cases, hospitalized or ICU, or then subsequently deaths, which occur much later. What we're going to have to wait and see is whether this increase translates into an increase in the number of hospitalizations, or whether, like the initial Omicron, there was a disconnect between the number of deaths and the admissions and the actual number of cases. So it's quite possible that it may in fact be similar to the one that occurred before. Hopefully so.
Can we relate the numbers that are rising to the easing of lockdown restriction? In fact, the complete scrapping, one would even say, of the state of disaster nationally?
I don't think so, because in fact the scrapping occurred after the increase in the wastewater of the virus itself. So it may now increase or cause a further increase in the transmission of the virus now that it has started going again, but this appeared before the actual state of emergency was abolished.
Yeah, and as a result, does this, I suppose, still make a case for the wearing of masks as one of the protective measures, one of the protocols in place?
Well, I certainly still believe that in certain circumstances masks are of value. But we mustn't be silly about this. We have to remember that unless you're wearing an N95 all the time, and we have to remember that the virus is in fact airborne, and transmission therefore can occur quite easily if you're wearing just a cloth mask or one of the surgical masks that don't really protect you adequately as well. And the other thing is we need to do away with silly rules or silly behavior whereby we go into a restaurant with a mask on, then we sit down at the table and we take our mask off, as if you are then suddenly immune to infection merely because you're sitting at a table. So I think that masks certainly can help, but don't expect them to be of particular value now that we know it's an airborne virus and that we cannot all the time, or people will not all the time wear their masks properly anyway.
Yeah. Is it a given that the resurgence would be associated with a different variant, or we could possibly again see a resurgence that is related to the Omicron variant, which we know is more transmissible but not as severe as far as illness is concerned?
Okay, so the reason for the decreased severity of Omicron was probably due to some decrease in the virulence of the virus, but was also related to the fact that we had a significant amount of immunity within the population, both from the point of view of vaccination, most importantly, and also in terms of previous infection. But there certainly is evidence that it is, in fact, or has been less virulent and causing less severe illness. This one, in some very latest data, seems to be driven by both the BA2 variant, which is present in the UK and Hong Kong and places like that, but also appears to be the BA4 variant, which are both offshoots or side shoots of the Omicron virus itself. So it may well be that those two are leading the way at the moment in terms of increasing the number of cases.
Yeah. Is there a way of understanding at this particular point what is going to happen in this particular wave of the pandemic?
Unfortunately not. All that we can do is hope that the large amount of immunity in the population will not decrease the number of infections, because as Omicron showed us, we still have a large number of infections, but that particularly the T and B cell immunity and the memory cells that remember previous exposure to the virus or to the vaccine will prevent there being serious infections with hospital and ICU admissions and then subsequently deaths.
Right. So what's important then to be consistent in doing now as far as the government intervention? One would say, I suppose, continue with the vaccination. Should we be once again putting more energy in the testing?
Well, I mean, that's a difficult one because test and trace is really not possible given the rate of transmission and given the large number of patients who have asymptomatic infections. If you have a large number of people who are walking around with the virus and are asymptomatic, you're not going to track them down, and neither can you then isolate them appropriately either. So the practice at the moment really should be vaccinate as many people as you can, have outdoor activities, try not to congregate in closed spaces with large numbers of people, and I still believe wear masks, particularly in certain circumstances.
Prof, I appreciate your time and thank you very much for your intervention tonight. Here on In Focus, Emeritus Professor of Critical Care at Wits University, Professor Guy Richards there, outlining some of the critical things that we still need to be observing as those numbers are certainly beginning to show signs of a resurgence.